human nose is not only a functionally important organ, but it is also aesthetically important because it is located in the central part of the face, and it is seen from both the profile and the lateral views, which gives it its aesthetic importance. Rhinoplasty is a surgical procedure to correct the deformed shape of the nose and to aesthetically enhance the shape of the nose, thereby enhancing the overall facial aesthetics. There may be multiple deformities with which the patient presents to a plastic surgeon. These include a hump on the nose, a broad nose, a drooping tip, a broad tip. There are other deformities like a flattened dorsum of the nose, and all these deformities can be corrected by doing a rhinoplasty. The most important part of doing the rhinoplasty is not the surgery itself. It is actually the assessment of the deformity, assessment of the proportions of the nose in relation to the face. And that is why the first consultation with the primary plastic surgeon is very important in this case. During rhinoplasty, what essentially we do is that we separate the skin of the nose from the underlying bony and cartilaginous framework which gives its shape to the nose. So after which we alter the shape of the bony and cartilaginous part of the nose, and we might add a few things inside the nose, and then the skin and the soft tissue is again redraped over the nose, giving the nose its new desired shape. There are basically two approaches to rhinoplasty. It might be an open rhinoplasty or a closed rhinoplasty. Both have got its own advantages and disadvantages. In open rhinoplasty, basically there is an external scar on the nose, which is generally not visible because it is situated on the underside of the nose, which is called as the columellar part of the nose. Open rhinoplasty is generally suitable if the amount of corrections which are to be done in the nose are huge. So if the surgeon is contemplating large amount of modifications to be done in the nose, then he would do an open rhinoplasty. In closed rhinoplasty, there are also incisions, but these incisions are situated inside the nose. So there is no external scar which is visible, and therefore it is suitable only for minor corrections which are to be done in a nose. The advantage being that there are no scars after this surgery. Rhinoplasty is essentially a very safe procedure if done in right candidates. There are generally you do not have major complications associated to rhinoplasties. Risks in rhinoplasties are generally there might be some amount of bruising around the nose, on the inside of the eyes. There might be recurrence of the deformities in some cases, and there might be some pain, and there might be some stuffiness of the nose in the initial period. Recovery from rhinoplasty actually depends on the amount of manipulations which have been done and therefore it will vary from case to case. Generally, if there is no bony manipulation done, the recovery takes around 7 to 8 days. If bony manipulations are done, then there will be a plaster kind of thing on the nose, which would take kind of 3 weeks to be there on the nose.